Jesus didn't have a problem with people that's in the streets. He had a problem with religious people.
How can I help anybody when I was not even able to help my own son?
I would never do that. I would never do that. And I became that in a matter of minutes when they took my pain pills away.
And I said, I'm not where I want to be, but thank God I'm not what I used to be.
This is Faith in Your Recovery. I am Randy Davis. Welcome to the battle. Hey, do you feel the excitement? We feel it here in the studio at the Christian Center in beautiful Anderson, Indiana, and we are glad to have you with us. Our guest today, at least our first guest, and we're going to tag team you with a couple here, is Kaylyn Mora. And you may recognize her voice, but I'm going to guess that was because she was our guest on episode 137. And I made note, Kaylyn, how during that episode I recognized and realized the advocate you are for reducing stigma and in the idea of increasing access to recovery resources. You feel okay with that description?
I love that description. Thank you.
All right. So we welcome you back. It's good to have you. And after we hear a little bit from Kaylyn, we're going to get to hear to her from the Aspire office and more about them and her tag team partner today, Bri Kaylyn. So, Kaylyn, go ahead and tell the folks, remind them who you are and what you're about.
Yeah, so my name is Kaylyn. I was here before talking about my personal story and what led me to where I'm at today. So now I can openly speak about I work for Aspire Indiana Health, and I work in the community doing hepatitis C and HIV testing, and working with individuals who, for the most part, have substance use disorder.
Okay, how long have you done that?
So, this is going to age me. I've been in healthcare for almost 20 years, and I've been with Aspire since last October.
What led you to healthcare? What is it that took you there that helped build and create that passion?
Yeah, so I have my dad, who is a recovering individual, a recovering addict, and then also I lost my mom to my stepmom to an overdose. Okay. So
personal experience
definitely led me into healthcare.
Yeah. Do you come from any type of background of addiction yourself?
I do not, and I'm glad you asked that because that's something last time and when I speak with people one-on-one that I'm very transparent about, that I personally do not have a history with addiction. That way, I'm not over here saying I understand and I know what you're going through, because I do not. I witness it and I witness how strong individuals are, but I want to make sure that I don't put myself out there that I do have a personal history, which I do not.
Tough question here, but do you see that as a positive or a negative in your career?
Both. Because, and last time I had spoke about how the desperate need for peer recovery coaches, because I feel like individuals with substance use disorder really benefit from speaking with people who have been there and have done that. So I do feel there is a huge need for that. And I really feel it benefits, but also a positive because it just gives me a different lens to see through. So I'm on a different journey than them. So maybe there's some things I can help them with. But I mean, I learn from other individuals as well. So definitely
Absolutely. Both. Well, we're similar in that respect. I don't come from a addiction background. I lost my mom to suicide. I've lost other family members to drugs and other mental health related situations. And having been a pastor for a number of years, I've done well over 100 funerals of those who have lost their lives one way or the other. So I've been that one who's listened to the parents' questions, and I think the moment of pride that I have is when I'm talking to somebody with that experience and they say, you just said you didn't go through it, but you get it.
Yep.
And that means the world to me. So I try to relate. I'm not an expert. Don't
Right.
claim to be. We're not at a better life, Brianna's hope, but we're people who care.
That's right.
And
That's
I
important.
think that makes up for a lot of faults and lacks.
Yeah.
That when our passion gets involved with all of that, it truly makes a difference. So what does it mean to you, the idea of increasing access to recovery resources? What does that mean to you?
Individuals can live the life they want. And if that's a healthier life, if that's a different path they want to go on, then everybody deserves that. So if we have an individual who is in active addiction and they want to become sober or they want to start their path of recovery, or like in my position, if they are diagnosed with certain diseases and they want to get treatment, then they can have that. So access to that is people living the best life that they can, that they want.
You know, I think that's so important for all of us, whether we're in addiction or it's never touched us, which I can't imagine anybody who'd be in that role.
Right.
But I think that's what it's about, living the best life we can possibly live. For me, being a man of faith, it's living the life God created us to live. And so that's how I deal with that personally within that. What has been the biggest challenge for you, Kaylyn, in all of this? Your work and your experiences blended together. Still, what's one of the big challenges for you?
In this job specifically, so again, being in healthcare for a long time, I've seen people with different diagnoses all over the board, taking care of people who are, because I have a background EMS, who are like, have trauma and are very, physically ill. And I see those people get the care that they need at that point. So then moving over into the world that I have a lot of people who have substance use disorder, one of the biggest challenges is stigma, because these people are not getting the care that they deserve for one reason or another, whether it's a barrier or whether it's because they're afraid of judgment. Or, I mean, why should somebody who's diagnosed with cancer or has a broken leg just openly go to the hospital and be like, I need help? But then somebody who's really, really struggling and, their life is turned upside down and they need help, it's a whole thing to get help. And stigma is a huge thing because of that. So that's probably in my field that I do right now, one of the biggest things we talk about is stigma.
So where do you see us as a culture at this time as far as the idea of stigma? Are we getting better at lessening, reducing that stigma, or do you think we're just kind of spinning our wheels at this time?
Definitely not spinning our wheels.
Great.
Because I'm seeing a lot of movement. So in my job, I'm fortunate enough to be in the community. So I meet a lot of people, and I meet a lot of people from individuals who are on the journey of recovery or inactive use, all the way up to individuals who elected officials. So I see everybody, and I see people who want movement, people who kind of are unsure how to make a change. And so we're definitely going in the right direction. But I also meet individuals who are very much stuck in the idea of, it even feels gross to say, but the ideas of substance use disorder that it's not true, about those individuals. So I think we're going in the right direction. We need to keep the movement going.
So when you talk about that movement, can you almost use the word change?
Yeah.
In there? You're seeing the change in leadership.
Yeah.
You're seeing the change at the grassroots, the common Joe, the common Sue, whatever.
Yeah.
And you're seeing it all over.
I am. And I'm seeing, and 1,000,000% to be respectful of elected officials that I speak with. So I would never in a million years say who.
Gotcha.
But I'm seeing wonderful change in these officials because they want to help. And I've seen the passion and the drive, and they want to, they will come to me and say, what do I do? Like, I have this person who needs help. What do? I want them to be okay. And it just makes my heart do flips because I'm like, this is amazing. Like, these individuals can start that movement, and I see a lot who really want it.
Before we were on air, I was telling you I've been at this about 10 years now. I remember a time when you didn't get that cooperation.
I've heard, yeah.
You didn't get that support from those individuals. But I understand that. That was back in the day when there wasn't a lot of help available. How old's Aspire?
That is a Bri question. I'm not sure exactly how old we are, but she's been here a lot longer than I have.
Okay. It's the idea, I think we're seeing those who are in recovery, doing recovery, maintaining recovery, and that gives those people in those positions hope, and it gives them an identity to be able to see, hey, this is working. I'm ready to jump on board.
Absolutely.
Instead of seeing that same person and that same struggle over and over and all that they go through. So that's an encouragement to all of us.
Absolutely.
Well, listen, Kaylyn, what else would you like to say before we switch seats here? Anything else on your head or heart, or you feel you need to let us know?
No, we did a lot of the talking last time, and I'm very grateful to be here, and I'm grateful that you guys are so open to what Aspire has to offer in our program. It's just a wonderful program, and it makes me so happy when I go out in the community to explain what we do and how we can help. And I hear people say, "Oh my gosh, like, yeah, let's put you on the books. Let's do this. I have this person." I'm like, this is an amazing thing that we have, going here. So thank you for allowing us the opportunity to explain ourselves.
Well, we want the folks out there, especially that struggler, to know what's available. If we don't tell them, they're not going to know.
Exactly.
Just like the scriptures say, if there's not someone sharing the word, how can others hear it?
Exactly. Yeah.
So
absolutely.
we want to share the word of Aspire and the hope that it gives and the healing that it can bring.
Absolutely.
Thank you.
Thank you.
Thank you for being with us today. We'll go ahead and have you switch seats there. Here in just a moment, we're going to have Bri Green from Aspire. Bri will share with us some of her background, what's gotten her to where she is, what it's about, and explain more to us about Aspire. Welcome, Bri.
Hello.
Hi, good to have you. Thank you for joining us today. Go ahead and tell the folks, introduce yourself to them. Let them know you.
All right. Well, my name is Bri Green. I have been with Aspire I celebrated 9 years last month.
Congratulations.
So working on a decade. My passion is public health, working with folks. And I started here right after I graduated college, and so this is what I know.
That's awesome. That's great. What was it that drew you to Aspire?
I think the community outreach piece, being able to actually meet people where they are. There's not an expectation that people have to come to us. We can travel, we can go out in the communities. As a program, we cover 32 counties, and I have had the opportunity to travel to all of those counties, to work with folks, to provide testing and education, and just help them be just a tiny piece of their journey, and hopefully make a difference.
What is it that keeps you going from day to day? I know this is draining work. This tugs at the heart, the mind, the time, the rest. That list goes on. I know that's the case in many positions, but I certainly know that when you're dealing with recovery, it's not 9 to 5.
Yeah. I would say the successes keep me going. Every day is something new, which I love. But when you see those successes and folks come back in just to say hi, and that's what keeps pushing me forward. And we have folks that they have so much potential, and so I keep sticking around because I know that something really great is going to happen, and And I want to witness that.
The anticipation,
Yes.
seeing somebody find recovery, find healing, find their potential, as you said. I have always believed if we're looking at the problem, we're never going to find the answer, that we've got to look at the potential, the other things around us, and it's out there. It can be found. It may be a Better Life, Brianna's Hope. It may be Aspire. It may be the Christian Center. There's somebody there to help. And we're going to applaud you wherever you choose and whatever path you take.
Absolutely.
We recognize that in recovery, if there were just one path that worked, you and I wouldn't even be here talking.
Right.
Okay?
Right.
But until we find that single path, we're going to be one of those paths. And I'm good with that. It sounds like you are as well.
Yes,
So,
100%.
yeah. What identifies Aspire? What's unique about Aspire? What sets it apart from other addiction recovery organizations' options?
So Aspire focuses on the whole person, which is really amazing. So we offer lots and lots of different pieces for the whole person, whether it is mental health, medical care, housing, our program, which is helping people either through harm reduction or testing for HIV and hepatitis C, connecting people to resources. But looking at the whole person is what Aspire does. And I think that's really unique.
Yeah, I like that idea, that whole person, because we've got to be complete if we're going to be able to move forward the way that we're designed to do, or even the way that we want to do. So let's just say, where do I start if I'm in my own addiction, I'm struggling? What do I do? I'm going to assume I make a phone call to begin with. If that's not right, correct me.
I think it's going to be different for every person. They're going to start wherever they see fit. So if that is medical care, maybe they need a medical provider, a primary care provider. They could make a call, or they can come right into the clinic and make that appointment. If it's someone that is actively using substances and they just want to reduce that harm, we have our syringe service program, and that is a great connection point. So a lot of people think syringe program is just one task, syringes in, syringes out. That's not the case at all. That's a wonderful, welcoming space for individuals to be connected to different services. And so if that person comes in and says, I want to be connected to medical care, or I want to be connected to a recovery coach, or I'm not sure what my HIV status is, we can get them tested. We can educate people. And so that's kind of a tough question. It depends on the person and what their need is and what their journey looks like specifically for them.
So where is the Madison County Clinic located? How would I make a contact?
Yeah, so Aspire Indiana Health, we have kind of a whole campus over by St. Vincent. My office specifically is 2009 Brown Street. That's where the medical clinic is located.
If I was going to be a walk-in, that's where I would go, right?
Yep.
2009 Brown Street, Anderson.
Yep.
Okay, go ahead, please.
Yep. And that is where, if you want connected to medical care, mental health care, there is a main lobby that you can go in. There's always a welcoming face there to greet you and help point you in the right direction. The end of the building at 2009 Brown Street is also where we provide HIV and hepatitis C testing, case management for people living with HIV, case management for people living with hepatitis C, and offering education as well.
What if I'm not sure my insurance coverage or I'm not even sure if I have insurance? What's my process?
Yeah, you can still come into that main area. The people at the front can always help with that. If you don't have insurance, they can get you connected with someone who can help get that set up as well.
So, what is one of the first things I can expect from Aspire? And folks, let me go ahead just to make sure I'm not slurring that word. It's Aspire, Aspire. All right, go ahead.
Yep. I think the first thing you can expect is just a welcoming space. People who are not going to judge you for what you look like, what you need, the questions you're asking. And I think that safe, welcoming space, that smiling face when you walk in is going to be the most important thing because that kind of sets the tone for Aspire.
A lot of folks in this old world that have their struggles don't feel very accepted most of the time. And it sounds like you're telling me I can be assured I'll be accepted as I am where I'm at.
Absolutely. Absolutely. No matter how you get there, you're
that.
walking in and we're happy to help.
Yeah, yeah. Over the years, what kind of changes have you seen in the recovery effort?
Oh gosh. So I've been here for a minute, and I can say there's been a lot of changes, grassroots, more programs popping up, different funding sources. Our program specifically has grown substantially in the last 9 years that I have been here. So the ability to provide different services for people, and I would say the political climate
For sure.
changes being made there as well. When I started there, we didn't have a syringe service program. That wasn't a thing, and we've been here for 6 years. So.
Hooray.
Yeah.
Hooray. Hey, Bri, we've got a question from one of our listeners, so I'm going to turn it over to Eric, and he'll give us that question. Here we go.
Yeah. This question is from Sean. Does Aspire provide individual case management for mental slash addiction clients?
Yes. So that is not specifically my area. But yes, Aspire does provide services for people living with addiction. And we also have mental health care therapy groups. So there's several different options.
So it sounds like you try to be available to a large group, a diverse group.
Yeah.
And my guess would be if you can't do it, you'll point them towards someone who can.
Absolutely. Especially with our program, we have so many community partners, and that provides a space for the folks that we're working with. So if we can't provide the service, we probably know someone who does.
Yeah.
And we're more than happy to connect those dots, make those connections, because ultimately we want the person to have what they need. And if we can be a part of that, then that's what we're going to do.
Yeah. How does your faith play into all of this?
Yeah.
Let me go ahead and ask that.
Okay. So for me personally, we're all on a path that has been created for us. And for me, I'm trying to stay on that path to follow whatever I'm supposed to be doing to help the next person. So,
and that path gets a little rocky at times, got a few chuck holes here and there, a little mountainous. The river floods across it, but we fight our way through, just like that individual who's fighting for their next breath. So it's important, too, as we always say here at Faith in Your Recovery, to stay in the battle. that the victory can be just around the next corner, at the end of the next prayer. It may take one more time in rehab than you wanted to give it, but that may be where the victory is at. Give it. Go.
And the support from others. You never know that next corner that you round, there may be someone else there waiting for you.
Exactly.
And that's what you need.
Yeah. So what do you think as a society is one of the biggest mistakes we're making? Where are we falling short?
We need to do a better job of listening to folks, making sure that everyone is at the table. And if they're at the table, are they able to speak and have their voices heard? Because a lot of times I think people that have the background or the education or the work experience think they know everything. And that's not the case. We need people with those lived experiences sitting at the table and talking with us.
So we should all be equals as we listen. Okay?
Yeah. Making sure that that we're taking those suggestions into account as well, not just saying, yeah, please come to the table, please talk to us, but then actually doing something with what is being told to us as well.
I like that idea. It goes back to communication. That's where so many of life's problems begin or find their solution, depending where you're at in that spectrum. But so many times I think we just listen to respond instead of to understand.
Yeah, and I think sometimes there's listening to check those boxes as well. Like, we did this thing, we had these people here, and that's not beneficial for anyone. We need to learn the difference between hearing and listening, and then acting on what's being suggested as well.
I think we've got to recognize those boxes change with every person.
Yep.
You talk harm reduction. That changes the boxes.
Oh, absolutely.
There are so many things that do. And so are we after what's best for that client, that individual, or do we want them to see our way as best? There can't be selfishness involved when it's somebody else's life. We can advise and share, but we've got to be open to listen.
Yeah. That's one thing that I talk to my team a lot about. They're out in the community working with folks, and we have to be comfortable with the journey that people want to take. Of course, when people come in, we have ideas, we have thoughts, we think we know what's best. But what's best is what the person wants. And we have to be comfortable with that. And sometimes that is a little uncomfortable because we can see the future sometimes, or we think we can. But that doesn't always matter. It's what does the person want, and how can we help without putting our own judgments and thoughts. And
I hear you there so clearly. It goes back to so much the idea, so this path has worked, it's worked. That's good for both of those individuals, but it may not work for me. It doesn't mean the path's wrong. It just isn't going to fit me. Maybe I want the scenic route, which will take a little longer, or vice versa. There could be those changes. What is the best advice you could give to a struggler out there who may be listening as a part of our audience?
Oh my gosh. So I want to be completely transparent. I am not a person that has a lived experience with addiction, HIV, hepatitis C. So I can only talk from a professional lens in terms of advice. But I would say if you have a question, ask it. Ask that question. If you need help with something, ask someone, because support is going to be the best piece to help someone. Because we know in any aspect of life, being alone and working through stuff alone doesn't always end well. And so if you have a question or a thought, bring it forward to someone. And if you don't get the information that you're looking for or the help you need, find someone else. There's always someone.
I read in a book, the hardest thing we can do is to ask for help.
Absolutely.
As simple as that is
Yeah.
in the thinking process, but asking for help says, I can't handle it. Guess what? My faith tells me we weren't created to handle it.
Right.
Okay?
Right. Yeah.
And that, our God can, our higher power, whatever that may be for you, if it's of a godly nature, it can get done. It's not in my DNA to fix myself. Now, I can be a part of the process. I can be a part of the success, the journey. I always like to say that, God will answer our prayers. He'll help us get that farm that we prayed for so long. But I've yet to hear of God driving the tractor for you. So you're going to have to do it yourself at some point.
Yeah.
But I can stand out there and guide you into how to drive that tractor if you don't know, and help you learn to handle those tools you're pulling behind it and keep you on the path. There are ways. What do you want folks to know as we get ready to wrap up here? What else would you like to say? How would you like to close this out?
Yeah. So just a little bit about our program specifically.
Absolutely.
So anyone that doesn't know their HIV or hepatitis C status, testing is free, confidential, can be done in the office, in the community. We provide case management for people who are already living with HIV or hepatitis C. And so if someone has been in care before and they're ready to get back into care, or weren't maybe ready before, we can help with that. And we also provide PrEP case management. And so helping people with prevention for HIV, and just knowing that we're here to help, and medical care, mental health care, emotional care, spiritual care, it goes in a full circle. And so taking care of one piece of yourself is good, but taking care of all of those pieces is even better, and it's going to set someone up for that path of success.
Where are we at as far as HIV and some of the other diseases you've talked about? Are we gaining ground on, for lack of better terms, beating that?
Yeah. HIV, it's still here. It's still very much a thing, if you will.
Sure.
And people need to be tested. There's still a huge stigma for people to get tested, or for people who are already living with HIV. So the importance of just creating that space, that safe space for people to be tested, to have those conversations. We always say that education is prevention. What you don't know, you don't know. And when you do know, that sets you up for that path of success. And so we go out in the community and do education, because if you don't know how HIV is transmitted, or maybe you think you do and it's a completely different way, it opens that door for you to say like, oh, maybe I do need tested, and then prep for keeping yourself HIV negative, or if it's already if the person is already living with HIV, then getting them connected. So yeah, it's we're making huge strides though. It's absolutely amazing how far we've come.
It's amazing to me, and I'm not in the healthcare field. I remember when HIV was the topic of the day, where you didn't take 2 steps without somebody mentioning HIV, quote, AIDS during the day, okay?
Yeah.
And the idea and all the misinformation that was out there.
Yeah.
And I think many of us, unfortunately, still carry some of that.
Absolutely.
That it was drilled into us because we were so scared. So we were grasping at straws. But we're starting to see a turnaround in all of that, at least help that can help the individual turn around.
Yeah.
So we need to know what that is, and how do we know without being educated? Knowledge is powerful wherever, we can grab that in whatever the situation may be. Well, listen, Bri, thank you.
Thank you.
Thank you for what you've shared about you, what you've offered us about Aspire. Thank you as well, Kaylyn, over here to the side. Thank you both for your time. We so appreciate the work you're doing, that Aspire is doing. You said there are, let me go back, you said like 32 counties that have an Aspire office. Is that accurate?
So there's not an Aspire office in 32 counties. For our program specifically, so Team Hope, we have 4 offices: Muncie, Richmond, Lafayette, and Anderson. Each of those, they have a specific region that they cover. Yeah,
okay.
Yeah. So we have staff, the team going out into 32 counties.
You've got coverage for 32 counties, yeah?
Yep.
Good.
Yep.
Thank you for clarifying that. I don't want them hunting the office in every county, all right, that involved.
Yep.
Once again, thank you for your time. And folks, thanks for tuning in today and listening to this. We hope you'll continue to follow us, subscribe, like what we've got to offer. We always appreciate your questions, your comments, so share those with us at any time. But above all else, stay in the battle. Recovery's worth it. Once you get there, you're not going to want to turn around and go running back to where you were. I've yet to meet somebody who said, that's my goal, is to recover so I can purposefully relapse. No such thing. God bless. Stay with us. Stay in the battle. We care. Thank you.